Some antidepressants can make you gain weight, sometimes 15, 20, or even 30 pounds in a year. But there's one that often does the opposite. Studies show that some people can lose 2 to 4% of their body weight on this medication, but there is even a greater chance of weight loss when it is used in a certain way. I'm Dr. Air, quadruple board certified psychiatrist and anxiety expert. Here's what you need to know first. This medication is not a weight loss drug. It was never designed to be one. But the way it works in your brain affects the same circuits that control hunger, cravings, and energy. That is why so many of my patients notice their pants fitting looser within a few months of starting it. Now compare that to almost every other antidepressant on the market. Drugs like Lexapro, Zoloft, Prozac, Paxil, Celexa. These are SSRIs. They mainly raise serotonin, and SSRIs, while helpful for mood, have a side effect most people are never warned about. It can increase appetite, slow metabolism, and push the body to store more fat. This is why I see patients all the time who tell me, I started feeling better emotionally, but I gained 25 pounds, and now I feel worse about myself than before. The drug in question, Wellbutrin or bupropion, is what we call an NDRI. That stands for norepinephrine and dopamine reuptake inhibitor. In plain English, it increases two specific brain chemicals in the spaces between the brain cells. Norepinephrine, which controls alertness and energy, and dopamine, which controls motivation, pleasure, and reward. Wellbutrin can even cause you to lose close to 10% of your body weight when used in combination with another medication. I'll discuss this further in a bit, but first, I need you to know that weight gain on an antidepressant does not mean you're weak or lazy. Your medication changed the brain chemistry in a way that made your body store fat. That is biology, not willpower. The research backs it up. Paxil is one of the worst offenders. Remeron can cause significant weight gain in just a few months. Even Zoloft and Lexapro, which are considered weight neutral, often lead to slow creeping weight over a year or two. Medications like Abilify and Seroquel XR are sometimes added to antidepressants to help with mood. These medications cause even more weight gain than other antidepressants. Wellbutrin, on the other hand, works on a completely different pathway. And that pathway happens to suppress appetite rather than stimulate it. Here's the part most doctors never explain. Dopamine is not just a feel-good chemical. It is the brain's reward signal. It runs through a circuit called the mesolimbic pathway, which connects directly to the hypothalamus, the part of your brain that controls hunger. When dopamine is low, the brain looks for fast ways to spike it: sugar, carbs, late night snacking, scrolling on your phone, online shopping at midnight. When you raise dopamine with Wellbutrin, the brain stops screaming for those quick hits. Cravings quiet down. The constant background hum of "I need something" softens. I had a patient in her late 40s. She came to me depressed, exhausted, with poor attention and concentration. She had been on Zoloft for 6 years and gained 22 pounds. She could not lose no matter what she tried. We slowly transitioned her to Wellbutrin. Within 4 months, she had lost 14 pounds without changing her diet. But more importantly, she told me, for the first time in years, I'm not feeling depressed. My attention and concentration have improved. I'm doing much better at work. Now, if you're finding this content helpful, subscribe to this channel. I go deep on such topics every week. Back to Wellbutrin, and this next part is something you definitely want to know about. Wellbutrin is the active ingredient in another medication you may have heard of, Contrave. Contrave is FDA approved for weight loss. It combines bupropion with naltrexone, which blocks the brain's opioid receptors. Why does that combination work? Because food, especially sugar and processed foods, trigger the same opioid reward system in the brain that drugs do. Naltrexone blocks that reward. Bupropion increases dopamine in the spaces between the brain cells. Together, they decrease the cravings from two different angles. Studies show that people on Contrave lost about 5 to 9% of their body weight over a year. This is meaningful, especially for people whose anxiety and emotional eating are tightly linked. This is the part that surprises my patients the most. The same medication that helps with depression and anxiety is also a building block of an FDA-approved weight loss drug. This is not a coincidence. That shows you how closely mood, cravings, and metabolism are connected. Now, let me put this in context because the conversation has changed significantly in the last few years. You have probably heard of GLP-1 medications, Ozempic, Wegovy, Mounjaro, Zepbound. These work in a completely different way. They mimic a gut hormone that slows digestion and signals fullness to the brain through hormones like leptin and ghrelin. People are losing 15, 20, or even 25% of their body weight on these drugs. So where does Wellbutrin fit in? Wellbutrin will not give you GLP-1 level weight loss. It will not. But here's what it does that GLP-1s do not. It treats depression. It can reduce anxiety in certain people. It improves focus. It increases energy. And for people whose weight gain is driven by emotional eating, dopamine deficiency, or antidepressant side effects, Wellbutrin is often a better fit than starting a GLP-1. I have patients on GLP-1s, I have patients on Wellbutrin, and I have patients on both. The right tool depends on the root cause. Here is what nobody tells anxious patients. Weight gain on antidepressants is one of the top reasons people stop taking their medication. And then their anxiety and depression come roaring back, sometimes worse than before. Wellbutrin is FDA approved to treat depression and seasonal affective disorder, and it's also commonly used off-label for ADHD. While it isn't approved specifically for anxiety, some patients find it genuinely helpful for the anxiety symptoms. One of Wellbutrin's biggest advantages is that it rarely causes sexual side effects, which is a common problem with many other antidepressants. Because of this, we'll sometimes switch a patient from an SSRI to Wellbutrin or add Wellbutrin alongside their SSRI when sexual side effects become an issue. Now, you also have to know this. Wellbutrin is not for everyone. It can increase anxiety in the first few weeks. It can cause difficulty sleeping, which is why I tell patients to never take it after noon. It can raise blood pressure, and in rare cases at high doses, it lowers the seizure threshold. So it is not right for people with a history of seizures or eating disorders involving purging. For some of you, the weight will not budge even on Wellbutrin. That does not mean you failed. It means there are other systems involved: cortisol, inflammation, insulin resistance. We have to look deeper. Speaking of difficulty sleeping, here is something most people miss. Poor sleep is one of the biggest hidden drivers of weight gain, cravings, anxiety, and mood swings. When you sleep poorly, ghrelin rises and leptin falls. This makes your brain crave sugar. If you're taking Wellbutrin and not getting restful sleep, the weight loss benefit can be quickly cancelled out. I made a free sleep guide that walks you through exactly what to do. The link is in the description below. There is one more piece to this, and it is the most important one. Chronic stress over years or decades changes how your nervous system responds. It stimulates cortisol secretion via the HPA axis. It drives inflammation. It disrupts mitochondria, the tiny power plants inside your cells that make energy. All of these can contribute to weight gain. Your brain feels foggy, your motivation tanks, and no amount of willpower fixes it. This becomes even more common as we get older. For many adults in midlife, hormonal shifts amplify it. This underscores the importance of addressing the root causes of your weight gain, the root causes of your anxiety, the root causes of your mood swings. So we're talking brain inflammation, hormones, gut health, blood sugar control, insulin resistance, and mitochondrial dysfunction. And very importantly, lifestyle pillars such as nutrition, supplements, exercise, stress management, sleep, and social connectedness. This next video explains exactly how to do this.